And Representative Shaka Fattah is with us, Pennsylvania's 2nd District, and a member of the Progressive Caucus in the House. Congressman, the Progressive Caucus supported single payer. What is your reaction now that the law has been ratified by the Supreme Court and it's based on a private insurance delivered system?
Well, I'm extraordinarily pleased with the Supreme Court ruling. I supported the Affordable Care Act. And yes, there were those of us who wanted to go a little bit further. And as you could hear by your previous guest, there were those who didn't want to go at all. But nonetheless, we have, I think, the first step after almost 100 years, really, in terms of really moving our country to providing universal health care. So for tens of millions of Americans, they're going to be able to access health care, whether they're in West Philadelphia or Fairbanks, Alaska. They're going to be able to access health care. Kids with pre-existing conditions can't be denied health care. Adults won't be able to be denied health care. And I thought the court's reasoning was fascinating. In any government budgeting class 101, there's a little line where it says taxes, fees, and other revenues, which includes fines and user fees. And the court said, look, just like any other fine you might pay to the government for, if you don't clear the snow off your sidewalk, or if you drive too fast on the highway, you get a traffic ticket. If you don't provide for you and your family to have health care insurance, if you can afford it, you're going to have to pay this fine. And they said that's akin to a tax. And I know that's some Republicans act as if this is a sin word or something, but, we don't get a free lunch, and we have to pay for our way through life. And for those who can afford it, they should provide health care insurance, and if they don't, they will have to pay this fine.
Who will not be covered when the law is fully implemented?
Well, there will be. I was just in Boston on last Friday where this identical program was put in place, interestingly enough, by Governor Romney, and 98% of the people in the state of Massachusetts have coverage. 100% of the kids are covered. The reality here is that there will be, maybe an outlier, just like there's someone who will speed on a highway or not put their recycling items in the recycling bin. There'll be some people who will try to evade the law. But most Americans are law-abiding citizens, and the laws now require you to have health care insurance. And as you know, most Americans have health care insurance. And we have provisions for those who can't afford it. What we have up until this moment is we had groups of people who, would just wait until they would have to go to the emergency room and have you and me pay for it through our health care premiums.
Well, on that note, Jeff Neerhoff asks on Twitter, how are the 11 million illegal immigrants in this country affected by the passage of this bill? How will they get health care?
Well, if you're not a citizen of the country and with proper authority to be here, you're not covered by this law at all. And the reality is that that's unfortunate, because we really want to have coverage for anyone who is in our country. Because, for instance, if someone has a contagious disease and it's not diagnosed, and they're sitting next to your loved one on a transit vehicle, a train or something, it's a real problem. So I know that there's a lot of people who want to pretend as though other people are not, not worthy. But the reality is that for this law, because of the political circumstances, there's no coverage for them. And so, they have to go somewhere else and peddle some other myth for the moment.
Last question for me before calls. I looked about news coverage of you on the internet and found these two articles. Representative Fattah announces $3.1 million for neuroscience and other research at University City institutions in Philadelphia. And a similar headline, Representative Fattah announces $9.2 million in grants to Penn for healthcare innovation, keying $12.2 million in savings. Where is this money coming from?
Well, these are federal grants that are competitively awarded through the National Institutes of Health, National Science Foundation. I'm one of the lead members on the science-related appropriations. I authored a major proposal that the President signed into law in December that creates a neuroscience collaboration across the federal government. working on brain diseases like Alzheimer's and Parkinson's, disorders like autism, bipolar diseases. It is a major initiative of the federal government, headquartered in the White House of Science. One day, love to come in and talk about it. We have tens of millions of Americans who are afflicted and affected by brain diseases and disorders. Many of our soldiers who've been injured have traumatic brain injuries. So I've been leading an effort in the Congress that has led to a major legislative success, and then we have a collaboration that involves all of the federal agencies, from the National Institute of Health, National Science Foundation, the Food and Drug Administration, the Department of Defense, and rushing forward on focusing on how we make real progress on brain illness, and also how we understand the healthy brain, how we can do more in terms of cognitive teaching and learning activities. So I was in Boston, as I mentioned earlier, visiting Harvard in one of their laboratories where they're doing great experiments about how to teach the youngest of children and how they learn, because we know at the earliest ages, young people can learn anything. We for so long have neglected this period in the kind of 0 to 6 category, and they were doing great work there. So I'm very excited about those grants that you mentioned. I'm more excited about...
Just to understand, this money is over and above any research money in the healthcare law. This is a separate initiative.
Well, they are both outside of the healthcare law, and some of the innovation grants that you mentioned going to the University of Pennsylvania are part of the healthcare law and funding. So you mentioned 2 different grant announcements. So it is kind of almost like the decision yesterday. In part, they are not a part of the healthcare law, and in part they are.
Let me get a caller from Indianapolis. Scott, a Democrat, you're on the air. Good morning.
Yes, I'd like to pose this question for Mr. Fattah. The previous representative, Mr. Price, was saying that it is no longer, if we go to the Affordable Health Care Act and we sign up with the government, with one of the government-funded insurances, that the patient no longer can talk with the doctor to determine their course of care, that it's up to the government. Could you respond to that? Because that is so frustrating, because, again, it's this playing into the fears of people that the government is making decisions for them.
Well, it's unfortunate that those people who oppose this have distorted the facts. The truth is that this is a private insurance-based system, and that the only thing that we're doing is really creating a platform for people to be able to access private insurance. And so their interactions with their doctors are going to be exactly as they are now, and that there's going to be no, government bureaucrat between you and your doctor. But, this law is going to be the law of the land. We'll get a chance to see it play out. And I think that the fears of, and maybe they're well-intentioned on the other side, but I don't really, I'm not sure about that, because they have purposely distorted a lot of this information and tried to really scare people that this is somehow socialized medicine, or something, but it's really not. It's based on really ideas that came out of the most, John McCain proposed some of these ideas. The Heritage Foundation proposed some of these ideas. This is a market-based system, identical in almost every respect to what Governor Romney put in place in the state of Massachusetts, which is working very, very well.
Mr. Fattah is in his 9th term in the House of Representatives. Before that, he spent 12 years in the Pennsylvania legislature. And in addition to being a member of the Progressive Caucus, he is the chair of the Congressional Urban Caucus. Next call for him in our short time left on the program, Louisville, Kentucky. Ellen, a Republican.
Mr. Fattah, have you read the law yet?
Yes, I have. How are you? Good morning.
Oh, good morning. I have been disabled, and I've had Medicare for 20 years with supplemental insurance. And it's getting more and more hard to see a doctor. And my supplemental insurance is with a large manufacturing company. And they just can't. they can't find doctors to take. And doctors, 3 of my doctors have retired because they don't want to go through the amount of money and paperwork that it's going to take to go with this. So I'm concerned about, and I have, because I have been home, watched a lot of the put together by the House.
Ellen, I'm going to jump in. Thank you. We're almost out of time. Congressman?
Well, I think that what was said is that she's been on a government insurance, health care insurance program for many, many years, and that she has some challenges, as all of us do, but maybe that in this instance, you know, she's had to rely on Medicare because she's disabled. But that's what we need to have a safety net for. I'm proud to live in a country that would make sure that she had the kind of insurance that she needed. And she talked about access to doctors. You know, one of the things that we need to do is to really ramp up the educational opportunities for so that we can have more physicians, and that this is embodied in the Affordable Health Care Act. There's a whole student aid and education portion of some $65 billion in additional aid to get more of our young people into college.
But Congressman, let me interrupt. I'm sorry, we only have a minute left. I heard her say that she was concerned that some of her physicians were retiring because of the increased bureaucracy and paperwork they're facing.
Well, you know, 10,000 baby boomers are retiring every day. So people are going to retire. Doctors are going to retire when they get to a certain age. And the issue around paperwork is one of the things, as you just saw in the news in the last 10 days, because of the Affordable Care Act, 100,000 medical providers now on electronic systems. And this is one of the things that was funded out of the Affordable Care Act so that we can get out of the paperwork business. We can get into the age as every other industry has been in, which is using technology so that you don't have to burden physicians with filling out all these forms, and you can follow patients, their insurance companies will be able to keep track of their records electronically. So this is one of the great advantages of the Affordable Care Act, and I just think that for everyone in our country, the Supreme Court is the last say on this. They've spoken, and I think that we now can move forward in making sure that people who've been in the shadows, who've had no coverage, no doctors to see, no opportunity to have coverage, are now going to be able to, in the wealthiest country in the world, they're going to make sure that they can have a quality health care. And I think all of us should applaud that, because I think that that's what it means to be our brother's keeper.
Congressman Fattah, thank you. That's it for our time. We appreciate you being with us this morning.
Thank you.
And to our viewers, thank you. We have just a 2-hour program because the House of Representatives is in session today, coming up, including work